Incision care after a C-section. So there are 3 different ways that your incision can be closed. The first one is it is closed with dissolvable suture underneath the skin, and then they put steri strips on top of it, which are these like clear thin band-aids, okay? If they do the steri strips, you can take those off in about 72 hours. The next one is they suture your skin with, once again, dissolvable suture underneath the skin, and then they will put a surgical glue on top of it. That surgical glue gets kind of gross afterwards, and about days 7 or 10 after your surgery, if it starts to get gross, you can pick it off. The third one is staples. Usually those you will either get removed before leaving the hospital or you'll come back to the office. They usually get removed on day 3 to 7. When they get removed, it's not as painful or scary as it sounds. You'll feel an occasional pinch, shouldn't be that painful. As far as for showering, okay? If you have steri strips, wait at least 72 hours before showering to allow some of that skin to heal. If you have the surgical glue on top of it, you can shower the next day. And if you have staples, once again, wait 72 hours before showering. Once you get in the shower, you never scrub your incision. You let the soapy water run over it. And when you get out of the shower, you pat it dry. Since you just had a baby, every pregnant woman has a belly that falls over their incision, okay? Do not be ashamed about that. That isn't very normal. If you can't get it dry with padding, you can lift your stomach up, grab your blow dryer, put it on the cool setting, and then blow dry it dry. If you run out of the pads that they give you at the hospital, put a maxi pad on there, just like as it whisks away the moisture when you're on your period, it will whisk away the moisture from your skin. Bacteria love warm, moist, dark places to grow. So the drier you keep your incision, the more air to it, it will decrease your risk of infection. And speaking of infections, when to call your doctor. So if you are having severe pain at your incision site, there is redness that is worsening, it is spreading, you are starting to have pus-like discharge, bleeding, weird clear discharge, please do not hesitate to call your doctor to have them take a look at it, so that way they can make sure it's not infected. Everybody should have an incision check at 2 weeks. Please go to that appointment. It's very important. It's for your doctor to take a look at your incision to make sure it's healing appropriately, make sure you are doing okay. After that incision check, if you've gotten the clear and that your incision looks good, you can start using a scar cream if you want to help reduce the appearance of it. Unfortunately, some genetics and body types, their scars don't heal as well, and you might keloid from it if you have keloided in other parts of your body where you've been cut. I really hope that answers some questions. Bookmark this for later. If you have a C-section or any other type of surgery, this is great incision care advice.